Hello, I'm Dr. Rearick, and I'm a foot and ankle orthopedic specialist at Ventura Orthopedics. I'd like to talk to you today about ankle fractures. Ankle fracture is probably the most common orthopedic injury that I see in the office. When I'm looking at ankle fractures, the most common bone that I see broken is the fibula. The outside of the fibula is called the lateral malleolus. That's the most simplest form of an ankle fracture. It can be more complex and involve other parts of the ankle. And when we start to add more complexity to the types of fractures, that leads to more potential for instability and alignment issues that are key decision makers in determining how the ankle fracture is treated. Other parts of the ankle that can be affected with an ankle fracture would be the medial malleolus, which is the inside part of your shin bone, or in other words, the tibia. And then in the very back of the ankle is another portion of the tibia called the posterior malleolus. So when you break the fibula, or the lateral malleolus, with the medial malleolus, that would be considered a bimalleolar fracture because you've broken two sides. If you've also broken the back, that would be a third portion of the fracture, and we call it a trimalleolar fracture. Adding multiple sites of injury leads to more likelihood for instability and therefore need for surgical fixation. Sometimes when you come into the office and all we have is a fibula fracture, we can't determine how unstable that fracture is without doing more workup, including a stress x-ray. With the stress x-ray, it's a simple procedure or a simple technique that I do in the office to determine if there is also ligament damage associated with the injury. The ligament damage may involve the inside portion of the ligament called the deltoid ligament. It may also involve what's called the syndesmotic ligaments, or the high ankle ligaments between the tibia and the fibula. Here's an example of one fracture that the patient has come up with involving the fibula. But as you can see here with this stress x-ray, there's increased space widening between the medial malleolus and the talus. And that indicates that the entire talus is translating to the outside and not staying in line underneath the tibia. This is a fracture that would need fixation. Most of the time, fixation is going to require a metal plate and screws stabilizing the fibula. And once that's stabilized, we'll also assess, does the ligament damage need to also be addressed to stabilize it. Most ankle fractures will heal in about 6 weeks following surgery. At that point, we usually start weight bearing and we start physical therapy. If you've broken your ankle or think you have a serious ankle injury, I'd love to take a look and assess what you might need to help treat it best. Thank you.